This is our iTero scanner, and the reason it's called a scanner is because we have this wand, and it's not turned on right now, but this wand it's lit, and when we go over the teeth, it takes the video image and loads it into our scanner. So now once that is done, and it takes maybe 15 or 20 seconds to scan the entire mouth and get images of the teeth on the screen. It's really a wonderful tool. I tell you, when I first saw it, I couldn't believe it, and because we've used photography in dentistry for a long time, but now when we have a live video image, we can manipulate the image to make it more visible to patients. So for example, here's some images of this patient's teeth, and patients have never really seen their teeth in this view before. They just kind of see the front teeth. So we can not only manipulate the image by rolling it around like that, I can isolate and say, you know what, I kind of want to see all the top teeth. So I can rotate this down and say, okay, this is what the patient's teeth looks like, and they can't see way back here. But now when I'm doing examination, I'm not looking directly in the mouth just yet, because I can see more here, so I can communicate more directly with the patient. And this is a kind of a good example of a lot of different things. The patient's had, a few crowns on the teeth, missing some teeth, and over here we see some old fillings. And so when the dentist sees things like this in the mouth that really have been in there for maybe a number of years, and they're not as healthy as they could be, I could tell the patient, you know what, I think this tooth or all these teeth need some treatment, and my recommendations are, filling or a crown or something. And inevitably, patients almost always say, well, what about that tooth? It doesn't look very healthy, or what am I going to do to replace these teeth? So there's a co-conspirator there, I call it, for them to help self-diagnose their own teeth. Sometimes people get distracted by the color of teeth. They don't really like them, so I can say, you know what, I want to look at the teeth without the color on it. So now they look like models or plaster casts that we have in our hand, and we can see how they fit. What else is really kind of fun? I want to know what their bite's doing, so I can ask the computer, okay, where are the teeth touching each other, and why are they wearing down? So now with this color-coded scheme, it's telling me where the teeth are hitting and how intense they're hitting. So for example, red is where they're hitting the heaviest, and these other areas is where they're not hitting. So it really starts giving me a lot of insight of what's happening in the mouth, and it's really a very accurate technology to be able to do that. So it's just a wonderful tool. It's probably the newest technology in dentistry that's really revolutionized how we treat patients on a regular day-to-day basis.